Thank you so much. And thank you for that final comment. Thanks to our speakers. We're going to close the panel. And I just have a few final comments. As was mentioned, this workshop is in a series of workshops, the last to be held in October, where we will take this discussion further to talk about building back better, and then how do we improve structural systems and inform action to address obesity at the individual, the organizational, and the level of policy, as we talked about. I think that last question was so key. Do we do either or, or do we do it all? Is it important to look at obesity care as well as these policies, or the policy level that thinks more not only about food systems, but about other determinants of obesity? I would like to thank our planning committee, our terrific speakers, and all of you that joined online. The recording from today's event will be posted online in the next coming weeks. Proceedings in brief will also be released later this fall, and you will receive a post-evaluation for the event shortly to make sure that you provide your feedback, because that's really important to us, particularly as we plan the last workshop in October. So we asked if you would fill it out. I have just a few closing comments. I think today's speakers were fabulous. And as I mentioned, thank you for participating. This second workshop allowed us to really do a deeper dive into the behavioral, social, and structural determinants that shape obesity risk, but also how our understanding of those determinants point to systems-wide communication, policies, and programmatic solutions. Although a key focus was on health communications, I thought Dr. Nieder-Deppy, as he mentioned, communication strategies may be premature if we don't have shared agreement or really spend time on thinking about what are those shared goals, values, and outcomes. Kobe, as well as Dr. Connor, kind of mentioned this idea of, if we don't speak the same language, or we don't really understand what impacts are important, what values are important, then really we may be talking across purposes. And that, how does our data really play a role in guiding and helping us understand what kind of things that we need to be focused on? But also, I think Kobe mentioned who's at the table. That's so important when it comes to representation of values and understanding whose values are really represented when we think about these solutions. Attorney DeGia also mentioned that. How do we be patient-centered, community-centered, and really focus on community capacity building and user equity and asset-based lands? So we're going to close the workshop. That last piece about community is so relevant, community mobilization. And as we discussed, and we move into the next workshop, this building back better, and who defines the building back better. So stay tuned to our workshop in October. And we want to thank you again for attending. So we're going to close out. And thanks to our, as I mentioned, planning committee and our speakers. So take care.